So what we have been doing here in Chicago is partnering with already our health systems that they're very prepped in the infrastructures of vaccinating our population every year. And we have paired with pharmacies, which have been not pioneer, but taking like champions in vaccinating our residents at the nursing homes and long-term care facilities. And the city, as always, takes care of those that are vulnerable, and it jumps in just to fill the gap. The first part of the vaccination strategy is 1A, which is healthcare providers and also residents in long-term care with the personnel of these places. So we're talking about workers. If you see the logistics of the rollout is workers, workers, workers. And so we have taken those that are higher risk and more, and those that are also at risk of dying secondary to COVID. And because of the nature of their job, they're exposed to COVID, even if it's at the COVID unit or it's the emergency room or any COVID products that they are exposed to. So we're taking those up front. And right now we're almost finishing. I mean, we're talking about 400,000 of employees here in the Chicago land alone. So it's taking more than a month, as you can see, and we're expecting that it's going to be overlaps while we move to 1B, which is going to be the workers, essential workers for first line. And as you can see, all of these that I'm mentioning are overrepresented by Latinos. So that's the population that we want to talk about today.
The advisory committee on immunization practices create this series of grouping or recommendations for who should get the vaccine first. And then the CDC takes those recommendations and create those like tier. And both of them are looking at how to decrease death and serious disease as much as possible, how to preserve the functioning of our society, and how to reduce the extra COVID, the extra burden that COVID is having in the already disparities that we are seeing in the community. So as those grouping are creating, and just like to talk about equity a little bit, so people understand why this is happening. Like, why do we have groups of people and we don't start like just opening this up to everyone? It's because we're looking at those components and thinking about how much vaccine we currently have available. It is less than what we need to. So that's why we're having that like phased or tier approach.
From institutions have been reporting that the uptake of the vaccine is as low as 25%. And today we found out 20% in other places are refusing to get the vaccinations. African Americans as well as Latinos are falling down to 25%. So this is a big deal. It's mostly happening in nursing homes, and it's because we're getting those reports as we go rolling out the vaccine. And we're only 0.5% of our population vaccinated so far. And here in Chicago, it's been referred that 68% have received, 68,000 people already have received the vaccine. So this is where we're moving. We're very slow. Plans are to, now that we start with our essential workers, we're expecting to get a lot of our undocumented. Hopefully everyone shows up. And we want to be sensitive because sharing sensitive information is a big deal in our undocumented population. And the mistrust of the federal government or La Migra. So those are things that really make this population so vulnerable. So the way that we have it is that they only need to provide a telephone number, probably, whichever number, just to call them for a second dose, and to be very respectful with their name, addresses, and anything that could be a barrier for this population to walk in. And the same thing is with undocumented, they don't have to present. The vaccination is important that everybody knows is completely free. These are vaccinations under the emergency use authorizations by the FDA, which means they have been already purchased by the federal government. No individual in Chicago should receive a billing even 1 cent in relationship with these vaccines. So the word is out there. We want to make sure that it's something that resonates with our population, that they feel comfortable, that safety is not an issue or barriers to our vulnerables. And that's the same with refugees. If we need to send our strike team to our shelters or any of these institutions that most of our vulnerable population are located at, that is exactly what we will do.
That local health department's responsibility is to ensure that all people, all the population is vaccinated and to help fill in the gaps so those vaccines are accessible to everyone. And that includes looking at the disparities and what barriers people may face in order to access, whether it is the first or the second dose. So what are things that we can do to help bring those barriers down? And another important aspect of that is communication and education in the community. So looking at collaborations where you can help disseminate information about the vaccine process, and you can also listen to what are the concerns of the community so you can help inform your communication and your processes better. So that is something that definitely helps to add for an equitable and ethical and transparent distribution of this vaccine. And, just like continue to work with different sectors like schools or other community partners as the vaccine becomes available to those sectors, so we can have that like information and that understanding, and people feel that they have the information that is needed to make the decision and to access the vaccine when it's time for everyone to get vaccinated.